We have one more presentation from Dr. Peter, and I said, can you just help me with your spelling or how to pronounce your name? And he said, just call me Dr. Peter. So it's still a mystery. I've been asking people all weekend, and we're never going to find out. So this is a great topic, and I covered this recently at Rare Disease Days in Cleveland. And when I proposed talking about AI in any way, nobody wanted to touch it. All these great researchers at Case, and they were like, we don't want to talk about that. So thank you for taking this on, Pearls and Pitfalls of AI in Rare Neuroimmune Diseases.
Okay, perfect. Well, thank you for that kind introduction. And as far as my last name, some things are not worth knowing. So, and I know I'm standing between you and your break. Some of you are probably not too interested in this topic. If you are not, I have two uninvited guests in the corner watching Parent Trap. They'll probably share their headphones with you. And so just a few words of disclosures. So, working with rare diseases has kind of had me in collaboration with industry and federal funding, looking at neurodegeneration and neuroinflammation. Not too much of that is going to be pertinent to AI, which is kind of a niche topic. The two things I think I want to share is one, I'm a little technology handicapped, I suppose, but I have been using artificial intelligence both as a individual and as far as a healthcare provider. I think myself and many others in the field were very skeptical as it was coming out. And I think that's a healthy attitude to have when it comes to artificial intelligence, especially as both as a patient and as a provider. But I'm going to try and convince a lot of you in the room that this is something that we're probably going to want to learn more about just because it has a particularly advantageous perspective when you're dealing with the rare neuroimmune disorders. So I want to just very briefly talk about what I am going to call artificial intelligence, though that's a very broad topic. I'm going to tell you a few words about how it's being used in medicine currently, both in the clinical care and the research realm. And it's got some good things and it's got some not good things about it. And so I think, this has a great opportunity for education and a little bit of discussion from the audience as well. And really before I go into artificial intelligence, as a practitioner, technology has really been to our advantage if you look at the history of medicine. So there's a lot of what we do in healthcare, and it's listening to folks and trying to get to a diagnosis and a treatment. And we've seen technology really transform that practice to our great advantage. And we've used technology, and this is a graphic really what is showing what was the first kind of public discovery of the AQP4 antibody, which was really revolutionary for NMOSD. Before that, we kind of knew it was its own disease. We had a lot of discussions and a lot of disagreements about how to distinguish it from multiple sclerosis. Some people were believers, some people were not believers, but this is really kind of put the foundation to what is our modern understanding of NMOSD. And it was a technology, right? So they had folks working in the lab, understanding how this antibody was working and how it was causing disease. And once we understood that, and once we knew it was a pretty good test for NMOSD, that really set the stage for innovative therapies to really transform the disability prevention for a terribly disabling disease. So, had we shirked this technology, I think we would be in a very different place today. And, with that backdrop, we should approach artificial intelligence the same way we approach any sort of innovative technology in medicine. And so, it is a new technology, and it's really, been brought to the forefront by computer scientists. And they've kind of coded and kind of designed these systems to really think like a human. They really don't think like a human, but they look like they think like a human. So they're pretty good at reasoning, learning, problem solving, all the things that we think are pretty unique to us as a species as far as our ability to think. They do so very differently, but on the surface, which is what we see a lot on the user interface, it will look pretty much like what we think. And so, in a sense, we're as these were being designed, we're trying to teach these things the same way we're trying to teach like an early doctor. How do you think like a neurologist? How do you think like a neuroimmunologist? And again, it's got some advantages and it does have some disadvantages as well. And, I really think if you look at how artificial intelligence is being adopted in multiple industries, but most specifically medicine, we are probably one of the last that is going to use it. And I think there's a lot of good reasons for that. And part of that is the sensitivity of the information we use in clinical care and research care practice. So we, are probably here on the curve, right? So, if I polled the folks in the clinic, I'd say probably 10 to 20% of the practitioners are using artificial intelligence in daily clinical practice at UT Southwestern. It's got some hiccups, but we're going to see kind of that wave continue to rise, and I think it's going to be part of standard practice, and it's going to be one of those things that if you're not using it, you're probably going to be left at a little bit of a disadvantage. And again, I think we had a lot of hesitation with artificial intelligence for a lot of good reasons. But if you look at it like any sort of technology, whether it's the cell phone or, light bulbs or, air travel, video games and things like that, the wave is kind of coming. And, every decade or so, there's a great technology that kind of disperses and it kind of changes how we deal with everyday life. If you asked me to practice medicine without my cell phone, I literally would not be able to do it. Like there's certain prescriptions I can't prescribe unless the state is able to communicate with me. So, I think it's just going to eventually turn into something like that. And, it's for everyone, right? So, it's not only for us as practitioners, but it can be a direct to consumer technology, right? So there's tons of these, too many to really list. But the tech industry has really reached for this to be a service to everyone, right? So whether it's ChatGPT, Claude, or Google, these are things that you could literally put on your phone and start using today. And even if you don't think you're a user, you are probably a user, because a lot of these services that most of us are using, such as my kids with Netflix in the corner, it's got artificial intelligence working in the background to guess what is the best next pick of movie you're going to use, for example. And so whether you realize it or not, you've probably been exposed, and it's probably interfacing with you. In the healthcare industry, there's a lot of different ways we're using it. There's a technology called the ambient listening technologies. I often call these scribes, meaning that it kind of listens into the conversation in the clinic room. It's all protected behind a firewall, meaning it's not sending that information anywhere, but it's basically creating a documentation to represent the clinic visit. Practitioners can use something called open evidence, meaning that if they're really struggling with a patient and they're trying to think, is there a diagnosis I'm missing or something like that, they can type in a lot of that information to these things and it will generate a differential diagnosis. There's this whole concept that we might be able to personalize medicine, meaning that we can feed some of these algorithms some data, whether it's like blood work or your history, and it might actually be able to find a perfect medicine for you. It doesn't work great at this point, but I think that is going to be something on the horizon. And even the folks in industry that are looking for the next best medicine for NMOSD or MOGAD and things, they're trying to use this technology to develop better drugs that will eventually make it this way to better outcomes from our patients. So it's here, and this is a couple of the examples that people have been using. We were really interested in how we might be able to use this technology to better diagnose people with rare neuroimmune disorders. And just kind of like anything in neuroimmunology, we kind of tested it against multiple sclerosis. So entered a lot of digital simulations for people that were anonymized, representing people with MS. We decided to basically put it into two groups, those within Gen Z and those in non-Gen Z. What's kind of interesting is the Gen Z interface, the way they interface with technologies, whether it's Google or artificial intelligence, is very different from their non-Gen Z counterparts. So they'll tell a lot more. And we looked at how long it took for the, let's say, ChatGPT to diagnose multiple sclerosis. So ChatGPT was quicker on average than the digital simulations of what it would look like in a healthcare system. But one of the problems with the way artificial intelligence thinks is it is very easily biased, right? So we looked at the model and we looked at some of the numbers, and it turns out that males who were entering the data were 47% less likely to get the correct diagnosis than women. So it's got some work to do. So, if I had to grade it, I'd give it a B. We did a very similar project with NMOSD, so about 476 digital simulations that are anonymized and kind of analogous to patients with an NMOSD. We looked at both seropositive and seronegative. Again, it's a little bit easier for the computers to figure it out if it is given the seropositive AQP4 antibodies. We looked at all sorts of different variant symptom onset and even the typical and atypical symptoms. And it was about, again, an 80% correct accuracy when it looks at diagnosing NMOSD. So again, I think it's, an 80% is about a B in my mind, right? So that's not necessarily ready for prime time, but, not bad, and all things considered when it comes to making a rare neuroimmune disorder diagnosis. So, it's always, I would encourage folks in the audience to kind of get a little bit more familiar with this, because I think it is going to continue to be something that's going to be helpful to us, both as patients and as practitioners. What you need to know about using artificial intelligence as a patient is, we know that medical information we want you to consider that as incredibly sensitive information. And we know that for a long time, that information, if it's getting in the wrong hands, they may be eventually used against you, and we don't ever want that to happen to you. You've got to kind of assume that whatever you put into ChatGPT or Claude is kind of going to a system, and it tends to save a lot of that information, right? And we don't necessarily know exactly where it's being saved and who has access to that information. And everyone's a little bit different. So, that's just my big word of caution. Just know that whatever you put into there, it's going to be able to be there probably forever. And it's actually, pretty incredible, if you pause and think about it, the ability of these artificial intelligence systems to problem solve. In medicine, there's a very incredible artificial intelligence service that is used for healthcare. What they did is they gave these systems impossible cases, meaning a limited set of information where, even the best clinician would not be able to figure it out. And the model got the accurate diagnosis about 40% of the time. Now, this was incredibly powerful computational analytics that was done in the background, but it is getting better, and it's probably going to eventually, be a great asset to us in healthcare. But know that whatever you're using, assume that information is going to be, non-private, whatever you enter into the systems. Healthcare industries actually have at this point, a lot of firewalled models, so that basically even the information that practitioners are putting into these systems are not going outside the university or the health system to be saved elsewhere. So much of the stuff in the public stuff, doesn't have that advantage. And again, how people and users interface with this artificial intelligence is, again, it's very susceptible to bias. So know that, if you're not putting in enough information, or you're not, essentially giving it wrong information, it may eventually spit out just, something that's not particularly helpful, which, again, you can sometimes use to your advantage if you're a little bit concerned. But otherwise it's pretty helpful. So, all right. Thank you.